All right, welcome everyone to a conversation about healthcare reform in the new Congress. My name is Dr. Sanjeev Sriram. I'm a pediatrician in Maryland. And with me is my comrade, Diane Archer, founder of JustCare, the go-to information source for older Americans and their care providers. We are both advisors for Social Security Works, a kick-ass nonprofit fighting to protect and expand Social Security, Medicare, Medicaid. You know the vibes. Let's just get right into it. Okay, we have a Democrat president, along with a slim Democratic majority in the House and an even slimmer majority in the Senate. So, Diane, what, if anything, can we expect to see in terms of progress with this political situation?
Really good question. We are at an inflection point. The pandemic has exposed huge fissures in a multi-payer, fragmented, for-profit healthcare system. And our healthcare system isn't working well for Americans, individually or collectively, for businesses. It doesn't work well for doctors and hospitals. It's really only working well for corporate health insurers.
Yeah. And what would you say are the biggest issues that we should be aware of and working on right now?
So the single biggest issue is that corporate health insurers are rationing care based on people's ability to pay for that care and based on their ability to navigate a really complex set of rules. They discriminate against people in poor health and people with limited means who need costly care. And even in a pandemic, we can't rely on them to make it easy for people to get treatment. What we're seeing is that Congress lacks authority over private health insurers. Even in a pandemic, the private health insurers aren't accountable to government. The government can't even get private insurance data to see where the biggest problems lie. And then, because we tie healthcare to work, the millions of people who have lost their jobs this year are without healthcare and struggling to get coverage.
Right. And so, okay, let's take these one by one. Right up top, we've got the insurance companies, these corporate greed machines. And like you said, they are rationing care. They ration based on ability to pay, they ration based on how well any of us can navigate these Hunger Games style obstacle courses. The prices keep going up, as we all know. And all of that expensive complexity pushes patients to delay care, and millions of people suffer. A lot of people die. And
Yeah.
right now we're stuck in this horrible situation where we're forced to rely on profiteering insurance companies that do not and will not guarantee people the care they need, and they're also not going to do anything to rein in these costs.
That's exactly right, Sanjeev. At this point, tens of millions of Americans are really forced to gamble with their health. They're forced to enroll in a health plan that may very well not meet their needs. And they're forced to decide whether to call 911 in an
Mhm.
emergency. They worry, understandably, that the ambulance and the ER could cost them hundreds of dollars and that they won't be able to then pay their rent. And people in poor health can't navigate the system. Even if they can pay the out of pocket costs, they can't get the needed approvals. It can take hours of their time. And getting healthcare is a struggle. It
Yeah.
should be easy to access critical care.
Right. Right. So, I mean, you and I know why it's this way, but why don't we go ahead and just, articulate why it's this way?
Yeah, I mean, the big issue is that Congress is letting private insurers run the show, really set the rules of the game. So government lets them profit when they deny care. They profit more when they deny care.
Right,
That's
right.
insane.
Yeah.
Yes, they have to cover certain benefits, but again, the government lets them decide when to pay for certain treatments. And so they're not held to account in a meaningful way when they're inappropriately denying care. There's no other advanced nation that allows insurers so much control over people's access to care.
Yeah. Yeah. So So specifically, how is public insurance for healthcare different from all of this?
Okay, so public insurance could not be more different from an accountability perspective than private insurance. From the individual's perspective, they're still going to the doctor and getting care, but just much easier and it's better coverage. But public insurance puts the government fully in charge of people's care. And it's not about profiting, it's transparent. The data is there to see what's happening. And government can then drive system improvements, knowing where resources are needed and where the problems lie. So, for example, people with traditional Medicare, public insurance, have it pretty good. They can access most doctors and hospitals anywhere in the country. They get reliable coverage from one year to the next. They don't need prior approvals, and they have few out-of-pocket costs so long as they have supplemental coverage. People with public insurance generally have easy access to care, which is critical, and that's so different from private insurance.
Right, right. So now let's talk about these crazy costs. It's just wow, right? And our multi-payer market-based system drives up the costs for its own benefit, but it just keeps going up and up and up without any kind of sustainability to it.
Exactly. I mean, it's crazy again because the incentives are all off, right?
Yeah.
The reality in this system is that insurers profit more, not only when people don't get care, but when hospital charges, doctor charges, and prescription drug costs are high, right? They get paid more in premiums and they have then a bigger piece of the pie for themselves. And so costs continue to rise. And the market isn't competitive in the classic sense. Hospitals tend to have the power to charge insurers high prices, and so do drug companies. So the prices end up being really irrational. I was reading today about new data showing that a C-section could cost $5,000 or $55,000. I mean, this is insanity,
Jeez.
right? The prices are all over the map. And the government in our current system has no way to ensure fair prices.
I mean, that's just insane. It's like you don't know whether the C-section is going to cost you a Ford Taurus or a Mercedes. Like, like what is that? I mean,
Right.
that's it's
And
just
the quality may not differ between the $5,000 and the $55,000. It's not at all clear
true
that
that. I mean, like,
5,000.
you're
Right.
getting from A to B, baby
Right.
is here, I mean,
Right.
like, but like still, I mean, like, whether it's going to cost you a Taurus or a Benz is like a bit of I mean,
Yeah.
it's just ridiculous.
Ridiculous.
Another ridiculous thing that you brought up earlier was about Congress's power or lack thereof to make these insurance companies behave themselves, cooperate. Elaborate on that for me.
Yeah, exactly. You just said it. It's truly a lack of congressional power to make these insurers behave, right? It's a huge issue and nobody talks about it. But Congress has really little control over these corporate health insurers. They have so much ability to do what they want to do that the government can't even ensure that they're complying with their legal obligations. They're unaccountable to Congress and they're unaccountable to the public. They're only accountable to their shareholders. And that matters for a lot of reasons, right? Among them, there's no national healthcare strategy that can work. Insurers are undermining our nation's ability to contain the pandemic and ensure everyone gets the healthcare they need. For example, people are getting big COVID bills for tests that they're taking, even though Congress has mandated that insurers can't charge them for these tests. So as a result, people aren't getting tested for COVID and the coronavirus is raging. That is just, again, just almost Kafkaesque in this
Right,
country, right?
right. I mean, and that's like during this entire pandemic, so many of us in public health and in health justice activism have tried to keep a really close eye on all this data about the pandemic. And
Right.
and it really feels like we have got like pockets of really good data and then like just these like big gaps. And it feels like the federal government doesn't have enough of what it needs to figure out who's getting tested, who's getting treated, where does like, like who's getting the vaccine, and then like where are systems working and where are they not? Because it's like, as a provider, I'm like able to, like share my little story on social media about like, yeah, I went to, such and such county and like got my shot, and then like I'm hearing from a colleague or friend of mine practicing medicine some in another corner of the country, and it's just like you would think that we're not in the same country when it comes to like our ability to like get vaccinated, our ability to help patients get the tests that they need. So like how does the insurance industry make this data situation worse?
Okay. So I think you nailed it. The insurance industry really compounds the problem of knowing what's going on. And anyone who believes that facts matter knows that data matters. But there's no national healthcare database, and you can't fix what you don't know, what you can't see. So, where are the biggest inequities? Which insurers are denying care at high rates? Which have high mortality rates? We just don't know. And it's because the corporate health insurers control who sees their data. And as a result, they're keeping us from being able to see the problems and address them in critical ways.
Right. And so, I mean, and let's move on to like that last issue you were bringing up about the this really painfully unnecessary link between jobs and healthcare.
Yeah, um, painful, right? We've seen that during this pandemic, millions of people have lost their jobs, and with that, their health insurance for themselves and for their families. And so long as people have to depend on their jobs for their health insurance, they're effectively without health care when they lose their jobs, unless they find another job or until they find another job. And health insurance is so expensive, it's just unaffordable for people to buy on their own. So as a result, our healthcare system ties people to jobs they don't want. It forces them to marry to get health insurance. It puts families at serious health and financial risk when people lose their jobs, as we've seen in this pandemic.
Yeah. So we've talked about five problems. The insurance companies are pretty much like they are a death panel, right? Like they ration care totally inequitably, like with zero conscience. They do not contain costs. And whether the market is broken or whether it functions perfectly depends on what end of profiteering you're on. Like,
Very well put.
because it's like the market is broken if you're a patient. It works excellently if you're a Wall Street person, right? Like it's
Well
doing
put.
exactly what it's supposed to be doing for your profits, right?
Right.
You have healthcare that is increasingly unaffordable, even for people with insurance. Like being insured does not protect you from, the how totally unaffordable this is. And you have insurance companies that are really not invested in making it affordable and have zero interest in playing a helpful role during a pandemic. The federal government and the general public don't have a great handle on on data for sure, but they're also kind of like, they don't really know where the insurers are really violating the law. Like those are like the misbehaviors where it's not just like unethical or rude or distasteful. It's like you have straight up like committed you have broken the law. Like that is a crime, right?
Right. Right.
And in the midst of all of this, people's health is at risk. From the pandemic, they lose a job, and now losing a job means that you've just put your health at risk. And this is the situation that our president elect is coming into, right? Like, and so like, can you help us like figure out like what exactly is Biden proposing in this S storm? I mean, like, you know what I mean? Like, what are we, like, what has he got on deck for us?
Really important question that we all have to be focusing on, because as of now, he's proposing reforms that continue to rely on private insurers. He knows, thankfully, that the federal government has to step in to quell the pandemic and help with healthcare costs. And he plans to give people larger subsidies so that they're better able to afford insurance in the state health insurance exchanges, and to expand Medicaid to the states that haven't expanded it. And that's helpful. He wants to offer Americans the choice of public health insurance modeled on traditional Medicare, he says. And he also wants to lower the age of Medicare eligibility to 60 and to negotiate prescription drug prices. So those are some of the bigger proposals he has on deck. Whether Congress is going to go anywhere with any of them is really the next question.
Right, and so that yeah, that kind of like brings up the next point, right? Like, should we be betting on Biden? I mean, like, how likely are these proposals to be enacted?
Honestly, not very likely, Sanjeev. They don't really appear to be a priority for Biden. Understandably, we got to deal with COVID, and we got to deal with a lot of other stuff to strengthen our democracy, although it should be obviously at the top of the list with these other things. But it's also not a priority for the Democrats in Congress, it appears. As one congressional staffer said to me, these are quote unquote aspirational reforms. So even with a Democratic Senate, there's little chance that the public option or lowering the age of Medicare eligibility is going to be enacted. They're heavy lifts and they're controversial. There's some chance that we'll get drug price negotiation for some drugs and for some people. And that's likely to be the biggest reform we will get if we get it. But not all Democrats favor allowing Medicare to negotiate drug prices. You would think that would just be, apple pie, motherhood and apple pie, really basic, not more than 90% of the public wants it. But we know that Bob Menendez and Kirsten Sinema, who are two senators, don't seem to be on board. And then we also know that in 2019, when the House had a very strong Democratic majority, they passed legislation to lower prescription drug prices, but it was only for 350 drugs, and it was over 10 years. So it was good. It was a nice first step, but it was a pretty small step, right? 350 drugs. There are 8,000 drugs out there. So it was far from sweeping. And it didn't even help the uninsured. It only applied to people with Medicare and people with private insurance. And now we have a weaker majority in the House. And so the thinking is that any legislation that passes now will probably be a weaker version of the law that passed in 2019. So there's not a whole lot of likelihood to see much. There'll probably be, you would hope, some health reforms that are hidden into the next COVID relief package, some goodies, but the big issues that we've been talking about are just not going to be part of that, and certainly not guaranteed healthcare for all.
This is depressing. Okay.
Yeah.
So we know, Biden is not a fan of Medicare for all, neither is chairman of House Ways and Means Committee, Richie Neal. That congressman's not a fan. Senator Ron Wyden is going to be chairing the Senate Finance Committee, which has jurisdiction over a lot of these healthcare issues. And Senator Wyden appears to like the private insurance industry. So given these obstacles from our supposed allies, how do we move forward?
Right, that's the $64,000 question, right? So we need to really be pressing our allies in Congress and the president to strengthen healthcare in ways that promote trust in government, just as Medicare and Social Security do. Fair drug prices is our best, hope of getting, and that should be at the top of our list. It should be easy, but it won't be. But we should continue to press Congress to regulate drug prices for everyone and benchmark those prices to what other wealthy countries pay, which is about half of what we pay. And it would be a triple win if we could get that, because it would increase trust in government. It would help most of the population and allow them to fill prescriptions that they currently can't afford to fill. And then from the government side, it would make money available for other reforms. So at the same time, fair hospital prices, fair doctor prices are also important, but sadly, that's not in the cards right now. And then changing the rules for corporate health insurers should also be at the top of the list. We need to move Congress to regulate the corporate health insurers in ways that drive accountability from them, just as Congress does with other industries, right? Unlike other industries where the harms are visible, we can't see, let alone undo, the damage corporate health insurers are wreaking on people who need costly care. And I really want to hammer home this point, Sanjeev, because while corporate health insurers might all be different, right? They operate under different names, and some have some doctors and others have other doctors, different copays and deductibles. At the end of the day, they all restrict access to doctors and hospitals. They all create administrative obstacles to care. They all impose financial obstacles to care, and they deter people from getting the care they need. Right. And in many cases, they're just wrongly denying needed services. They're coming between doctors and their patients. So we really need to change the rules of the corporate health insurer game to protect people.
Yeah. Yeah. I mean, and I just as like a provider, I can't accept it, the status quo. Yeah. I mean, to me, I just can't, I just don't see it this way anymore,
Yeah.
But how do we get Congress to work on changing the status quo? What would you say are the pressure points?
Well, one thing I would say that I think a lot of people don't appreciate is that private insurance, to the extent it exists in other wealthy countries, doesn't work the way it works here, right? In those countries, the private insurers are told not simply you have to cover home care or cancer care or the delivery of a baby. It's you have to cover these specific services, and these are when, and these are why, and this is what you're going to pay. And that's where the corporate health insurers in this country are able to get away with way too much, because they can decide, oh, well, you don't really need this MRI, or you don't really need 5 physical therapy visits. 1 is enough. And nobody's there to say to them, no, that's not the rule. That's not right. And they don't have to defer to the treating physician or the patient. They just can make it up as they go along. And then they can hide what they've done so that nobody can actually see what they're doing and hold them to account. So Congress treats healthcare as a commodity. And if it's going to do that, healthcare should obviously be a right. I think it goes without saying, but Congress needs to protect us from insurance product defects and risks, as it does with automobiles and toys. Some health insurers have high mortality rates. Tell us which. Some have high denial rates. Tell us which. And then Congress should dictate the rules of coverage, not simply the benefits, but when care is paid for, so that there's less room for gaming. And insurers don't have the free rein to decide whether they're going to pay for your ambulance trip. And just to compare that private insurance with the public insurance we do have in traditional Medicare, with traditional Medicare, the decision is left to you and your doctor, the care you get, and then Medicare pays. So that's what we really need Congress to understand we need from the corporate health insurers. Just to sort of bring home the point about what's happening with these insurers, there is a fabulous website called violationtracker.org. And on that site, you can literally go and see how many violations a health insurance company has been found to have. And in the last 20 years, United Health Group has had 307 violations and had to spend more than $600 million in penalties. But for them, it's just the cost of doing business. And they've made so much more. You can just imagine how many more violations they've had that nobody's found, right? How many they've gotten away with. And I was just looking again at other insurers, and CVS Health had more than 400 violations and paid out more than $1.1 billion in penalties. Anthem, 375 violations, paying out more than 600 million in penalties. They're just profiting handsomely, and the financial penalty is chump change for them. And that has to change.
Yeah. Yeah. I mean, I think that for a lot of our audience, that violationtracker.org is going to be a source of for our own, education. But I think like this is also a resource that we need to put in front of our members of Congress during town hall meetings and just straight up ask them, like, I mean, what is your plan on this? Because I mean, like, this is just flat out, like, it's just so wrong, right? I mean, like, I've got my patients in poverty get scrutinized harder for potentially being like earning too much, to be on Medicaid, and yet these guys, are
Right.
committing like penalties costing, up to $600 million, and it's like, they're still in business, it's like
Yeah,
like there's no shame,
there's no shame.
there's
There's no shame.
and it's and yeah, I mean, violationtracker.org, I think like this is going to be a powerful resource for so many of us when it comes to renewing our conversations with members of Congress.
Well
um
put. I think that's right.
but I want to talk a little bit about Medicare Advantage. These are the private health plans that that offer or supplement Medicare benefits, and they seem to have some popularity, and yet it seems to me like they work kind of like private insurance, or I mean, I guess don't work like private insurance doesn't work. Um, like I don't. I mean, can you just like elaborate? Like, I mean, like what's the deal with Medicare Advantage?
Yeah, they work just like other corporate health insurance. They don't work, as you put it. And their power, again, just like with all other corporate health insurance, needs to be reined in. Congress needs to act swiftly here, in particular, because they're threatening traditional Medicare and putting the lives of the most vulnerable, older, and disabled Americans at risk. And at the same time, we need Congress to strengthen traditional Medicare and give it at the very least an out-of-pocket cap, because that's people can't afford traditional Medicare at this point because supplemental coverage can be so expensive.
Right.
But
No,
yeah,
go ahead.
and then
Go ahead.
there's more. You and I have been talking about the Trump administration's
Yeah. So I
latest
mean,
initiative.
right. So they put in this. So they have a plan to privatize traditional Medicare. And I was wondering if you could tell us more about that plan, and how is the incoming Biden administration going to put a stop to that nonsense?
Yeah, it has to put a stop to that nonsense, that very dangerous nonsense. And we really all have to be advocating with members of Congress, and with Becerra at HHS and whoever the new head of the Centers for Medicare and Medicaid Services is, to end this social experiment that's really dangerous for people. But basically, the way it would work if it did go into effect is that it would really turn traditional Medicare into another version of Medicare Advantage, where the government would pay for-profit insurance company to cover care for people in traditional Medicare. And whichever areas of the country it was piloted in, people wouldn't have a choice but to be in these for-profit run traditional Medicare systems. So there's little accountability, and there's little ability to protect our most vulnerable Americans if the insurers start denying them care, as you would imagine they would do, because they'll make more money the more care they deny. And there are fewer consumer protections with this traditional Medicare initiative, which they're calling the quote unquote GEO model, than there are even with the Medicare Advantage plans. So the Biden administration must hit the pause button on this right away or as soon as possible. And that has to be top of mind as a major priority in terms of our advocacy efforts.
Right, right. I mean, and, when it comes to those advocacy efforts, to me, I feel like for a lot of our communities that we're in, right? Like there's, I mean, like when I talk to people about Medicare for All, what I find is that even before they are on board with Medicare for All, they are definitely not on board with the insurance companies. There is so much distrust for this industry, and to me, I think that, I mean, our main objective, especially in this first part of 2021, is to just keep fanning those flames of distrust, because it's on the money. Like they are right. Like, I mean,
Right.
people are correct to not put trust and faith in these private insurance companies, because these are not, I mean, these are people who are effectively killing people with their plans. And I mean, you can elaborate, but I mean, like, to me, like, there's a lot of it, like, this early work for us in 2021 feels fairly obvious.
I don't think I can elaborate. I just put an exclamation point on everything you just said. I think that's exactly right. They're dangerous to Americans, and we need to move away from them as quickly as possible. And that's why we're calling for Medicare for All, because we need an accountable, cost-effective healthcare system that guarantees everyone the care they need. And that's not what we're getting from these corporate insurers.
Yeah. And I mean, and so now, there's a lot of talk about the public option. And, I mean, to me, what I find odd about this public option, the most odd thing is that it has been in the American political conversation for a little over 2 years now, right? But I have not seen what it is exactly, right? Like there's zero, like it's this vague thing. It can be like whatever you want it to be. I mean, like, does it cover things like reproductive health care? Maybe, maybe not. Does it cover undocumented immigrants? Maybe, maybe not. I mean, is it actually going to, like, I mean, step on the neck of the insurance industry? Maybe, maybe not. It's like, it really can be whatever you aspire it to be, or it can be as meaningless as the two words could be, right? It's like, it's anywhere in between. Who knows? And
Right. I
so,
think, yeah.
I mean, but that said, right? Like, I mean, to me, like, is public option just code for lowering the Medicare age and making it a slow march to Medicare for all? I mean, like, what do you think?
I think that many people would like to believe that a public health insurance option, and again, fill in the blanks as to what that actually means, or lowering the Medicare age could move us closer to Medicare for all. But again, it's all theory and it's not at all clear. In fact, there's a lot of evidence that it would not move us any closer. It could easily move us closer to private insurance through private Medicare Advantage plans and hurt traditional Medicare. So I mean, this is the craziest example, I think, but in Washington state, the public option is private health insurance. And yeah, you heard me right. They call private health insurance offerings through the state their public health insurance option. I mean, it's crazy. It's Orwellian, right? There's nothing public about it other than that the state makes it available. But by that definition, we already have a public option in this country. We have public health insurance through state health insurance exchanges. That's not public insurance, that's private insurance. We need public insurance because it helps ensure people get the care they need, because it's transparent, because it gives the government the ability to promote system improvements, because it's cost effective and accountable to the public. That's why we need it. That's what we're asking for. So
Yeah.
call it what you want. You know, you don't have to call it a public option. We have to call it public health insurance, like traditional Medicare, where the government is in control of the care you get, but deferred in, I should say, the government is in control of paying for your care, and you and your doctor are in control of the care you get. That's what
Right.
we're looking for.
Right. I mean, it's really like that peace of mind of knowing that the government is going to take care of the bills, and
Exactly.
that all you're doing is scheduling that appointment, going to the appointment, figuring things out with your doctor. But like it is like that, the real peace of mind is going to be that like these bills that come up, the government's got you. You know, like that. And so, you know, I think what you and I have in common is that, you know, 12 years ago, I think it was, I mean, like, you know, Biden was VP. And I mean, at the, you know, back then, um, once upon a time, you and I supported the public option, you know? So what do you think changed?
Right. So what changed is I became a little less naive about the way politics works. You know, I thought the system was fair, that a public option would compete with private insurance on a level playing field, and private insurance would wither on the vine. There's less choice in public insurance and it's more expensive. But I was wrong, right? As we've seen with Medicare Advantage, it markets heavily to people who are healthy, and that's how it makes its money. And it uses stars like Joe Namath to deceive people into joining. And it's friends with, you know, a lot of the conservatives in Congress
Right.
and the administration, and it's been taking over Medicare.
Right. So what would you say we should be promoting now?
I think we need to be explaining to members of Congress why we need public health insurance, right? Improved, it has to be improved traditional Medicare, and how it would benefit us, right? So public health insurance is more cost effective than private insurance. There's even a new Congressional Budget Office analysis that finds, once again, that Medicare for all is cost effective. It treats healthcare like as a right. It gives people comprehensive coverage. You go to whatever doctors and hospitals you want to see. Basically, all your care is covered with few, if any, out-of-pocket costs, and it's less expensive than what we're spending today. And then we need to be advocating in the meantime to strengthen traditional Medicare. It has to have an out-of-pocket cap, as we've discussed. We've asked for it for a long time, but it would be really helpful to have that to help steer more people into, or I should say, help allow more people to join traditional Medicare. And what's interesting with that reform is that, yes, Congress would be great if Congress put that reform into place. But even without congressional legislation, it seems like the Centers for Medicare and Medicaid Services could also put an out-of-pocket cap on traditional Medicare as part of a project through its innovation center, because it wouldn't cost a lot.
Right.
It would actually save money in certain ways. It would be much less expensive than Medigap coverage.
Right.
And it would be a good step forward. So I think that's something we have to be looking into too and advocating for.
Yeah. I mean, and, you know, whatever it takes to really steer people away from these predatory, profiteering Medicare Advantage plans, which, I mean, Medicare Advantage is just private insurance by another name, right? So what would you say, like, what should be the fate of Medicare Advantage plans?
Well, I mean, I think we should recognize that whatever people think about them now because they're less expensive or people are healthy, they are absolutely a disadvantage to all of us over the long term. They cost more than traditional Medicare. As we've already gone over all the risks, they endanger people's lives. They get away with a lot because they have so much ability to profit by denying people's care. And so that's what they do. And so really we need Congress to recognize that private insurers should not be allowed to withhold care and profit from that. They should get paid at best a flat fee based on the amount of work they do, as that's what happens in other wealthy countries when there's private insurance. And if they don't behave, Congress should punish them, right? They should be out of business. And we, the consumer, should get our money back for what we've not gotten. This is really serious. It's really urgent because if changes don't happen quickly and Medicare Advantage plans aren't put in check, it's really likely that they will go the same way as chain nursing homes.
And what do you mean by that?
And what I mean by that is that they could end up taking over all of Medicare, and traditional Medicare could just go away completely. And right now, the only thing that's keeping Medicare Advantage plans alive and providing something, the reason people are choosing it is because they're forced to behave somewhat better than they otherwise would be, because otherwise everybody would just go into traditional Medicare.
Right.
So without traditional Medicare there to compete with them, they would be more likely to restrict access to doctors and hospitals more than they already do. They would likely deny care more frequently. They would likely provide less coverage and leave older and disabled Americans holding the bag. So it's really, really, really scary stuff, and we have to stop this.
Yeah. And what I've appreciated so much about our conversation is that these are things that everyday people need to and can talk about with their members of Congress. And I think that this is actually like a strong way for folks to enter the Medicare for All movement, because we are envisioning that like there's not going to be a role for private insurance. Like, we want there to be a strong, reliable, solid, public insurance system that for healthcare that that gives people peace of mind, that lets health be the focus of what they're doing at the doctor's office, that it isn't about like how are we going to knock out these bills or any of that. And I think that for to get through that journey, I think that the people can push their members of Congress to get tough on the insurance companies, start holding them more accountable, demand the data, like tell them that, listen, like $600 million in violations that we know about is a clear and obvious sign that you are not operating in good faith. What gives? And to really start putting the truth to Medicare Advantage being Medicare disadvantage. And I think that these are reforms that, as we build this, this strength, this power, this muscle, we're going to have what we need to finish the job and build Medicare for all. But I think that like what you're describing is definitely like it is a tangible starting point, and it can give people and our members of Congress, the urgency to work now. And with this, we've got a foundation upon which we can build bigger and better than what we've had ever before, and definitely since through this pandemic.
I couldn't say it better than that, Sanjeev. I couldn't agree more.
Yeah,
we got to move forward and really go after these corporate health insurers before they get us all.
Yeah. And I think that, this is within Biden's wheelhouse, right? Like, you don't have to be you don't have to be super fanboy of Medicare for All to do this work, this work still benefits all of us. But like, if it also has the happy side effect of strengthening our movement, then hey, it strengthens our movement and it builds public health at a time when we need it. I mean, in the midst of a freaking pandemic, that we still, yeah, there's like that itty bitty light at the end of the tunnel, but like, I mean, this is a long year we've got ahead of us. Like, and we've got a lot of, folks who, we don't know what it's like to survive COVID-19 for a lot of our patients and families. So, I really appreciate you taking the time to break all this down. It can be like, kind of like, it's easy to get, start off feeling kind of cynical, but I feel like there's a lot of work here that is actually very hopeful and very empowering. And I appreciate you, Diane, for breaking it down for us, because this is awesome. And I think that our audience has got like a lot of great work to do ahead of us this year. And thank you for it.
Thank you, Sanjeev.